Alzheimer's disease is a type of dementia which damages the ability of the brain to think, plan, and remember. The symptoms get worse over time until they are severe enough to interfere with the individual's ability to perform daily activities. It's important to begin with normal aging. Everyone has forgotten the name of someone who you haven't seen in a while. People even forget where they left their keys or where they put their glasses. Some people even forget to lock the front door. These things are all part of normal aging. They're all normal things, as opposed to serious forgetting, which makes it hard for you to function normally in life. It is when you forget how to make change when you are paying for something, forgetting how to use the telephone, forgetting your way home, something that you've been doing for many years. These more serious signs of forgetting actually impair the ability of an individual to function normally in society. This is what we call pathological forgetting, and it's something we see in Alzheimer's disease. There is a mnemonic, 4 letters, a 4-letter word that we can use to remember the symptoms of Alzheimer's disease. Those letters are F, L, O, W, or flow. F stands for forget. So you forget what you just said to someone, and then you start repeating yourself over and over again. L stands for lose. You lose important things. You lose your wallet. You lose money. You lose your way home. O stands for overlook. You overlook important things. You overlook paying the bills. You overlook your regular chores. You overlook dressing yourself properly. You overlook leaving a pot on the stove. These can impact on safety. W can either stand for wander or right. You wander off aimlessly and are unable to find your way home. This was wonderfully exhibited in the Mamadukwe video that was produced by GWAF. W can also stand for write, the need to write everything down to stop yourself from forgetting them, the need to create lists over and over again to stop yourself from forgetting them. These are things that you could do before, but you now find yourself having to write everything down. Those 4 letters, F, L, O, W, or the word flow, can help you remember the symptoms of Alzheimer's disease. So I want to begin by saying that Alzheimer's disease has no cure, unfortunately, but there are medications that we can use that can help reduce the symptoms of Alzheimer's disease. These medications, for their most part, are best started early on and during the course of the illness, which is why it's very important to see a doctor early and not delay the diagnosis of the disease so that these medications can be started early. The most common medication is Aricept or donepezil. And donepezil has the ability, when used early, to potentially even improve memory for a very short period of time before the individual's memory ultimately declines irrepressibly. But there are some cases when you start Aricept early, there are some cases where there is some slight improvement in memory during those early phases. The other big class of drugs is the memantine, and this is used for more moderate to severe Alzheimer's disease. And when used together with Aricept, there is some synergistic effect in helping to slow down decline and potentially stabilizing memory. But overall, there is no good treatment for Alzheimer's disease. And the treatment is usually directed at treating the symptoms, treating the agitation, treating the restlessness, treating the delusions and the psychosis and the hallucinations, treating the sleeplessness, treating the depression. The treatments are usually directed at treating the symptoms of Alzheimer's disease, as we still, unfortunately, do not have a cure. It is also It is also important to consider the caregiver's burden, because caregiver's distress also needs to be recognized, it also needs to be diagnosed, and it also needs to be treated. Caregiver's distress can manifest as social withdrawal by the caregiver, denial, irritability, deep melancholy and sadness, agitation, sleeplessness, and even health problems. All of these can severely afflict the caregiver who is suffering from Alzheimer's disease. So as we design a care treatment strategy for the patient with Alzheimer's disease, it's also important to consider a treatment strategy for the caregiver in case that caregiver undergoes overwhelming distress and inability to cope.